So in this class, we'll try to study the muscles, nerve supply, and blood supply to the hind limb. Okay. Here we have only the half of the hind limb here. That is one of the hind limb we have. And here, before going to the blood supply, nerve supply, we'll just look into the muscles which are present here. So here I'm not going to describe them like muscles acting on the hip joint, muscles acting on the stifle joint and all. I'll just show you which are all the muscles which are present here. To start with, see, this is the gluteal region and this is the middle gluteus. As we all know, superficial gluteus, it is absent in case of ruminants. So whatever the superficial gluteus is there, that will be fused with the biceps femoris, forming gluteobiceps. So it forms the gluteobiceps here. This is the gluteobiceps and this is the middle gluteus. And the deeper part of the middle gluteus, we have what is known as gluteus accessorius. So the deeper part of the middle gluteus is gluteus accessorius. And in the anterior aspect of the hip joint here, actually the anterior most muscle in the hind limb region or the hind quarter, you can see a triangular shaped muscle. This is tensor fasciolata. This tensor fasciolata, and here below this gluteus accessorius, you can see a nerve running here. This is cranial gluteal nerve. Okay, this is the cranial gluteal nerve, which is a branch from the sacral plexus or the lumbosacral plexus, and along with this you will be getting the cranial gluteal artery also, but in this specimen we don't have the artery right now here, otherwise it will be here. So this is cranial gluteal nerve, tensor fasciolata, middle gluteus, gluteus accessorius, and this is a part of gluteobiceps. And deeper to the middle gluteus, when we cut the insertion, see it has got three different insertion points. When we cut the insertion points of the deep gluteus, we'll be getting the cut the insertion points of the middle gluteus, we can see the deep gluteus here, somewhat a fan shaped muscle here, somewhat a small fan shaped muscle around the hip joint here. So this is the deep gluteus, this is the deep gluteus. And again, so I told you, this is the anterior gluteal nerve or the cranial gluteal nerve, and you can see a thick nerve bundle here. This thick nerve bundle is the sciatic nerve, which is also known as ischiatic nerve or sciatic nerve. So cranial gluteal nerve, ischiatic nerve, and this is the caudal gluteal again. So this is the caudal gluteal. These are the main nerves which supply nerve supply to the hind limb. Apart from this, you can also see a glistening membrane here. Can you able to see this? This is greater ischiatic foramen here. This is the greater ischiatic foramen. This is the greater ischiatic notch. Here you have the lesser ischiatic notch. This is the ischiatic spine. So around the ischiatic spine, we will be having the deep gluteus. So whatever the nerves which are formed on the medial side, they emerge out through the greater ischiatic foramen. Then then separates the cranial gluteal, caudal gluteal, and the sciatic nerve. And this glistening membrane is the sacrosciatic ligament. This glistening membrane, what you are seeing is the sacrosciatic ligament, and you can see one of the branches which is coming out here. This is the cranial gluteal artery. I'll tell you later what are the different branches and how does it arise. Otherwise, this is the cranial gluteal artery which was supposed to go under the gluteus accessorius, and finally it was supposed to end up in the tensor fasciolata. Anyways, it is not here. Otherwise, tensor fasciolata, gluteus accessorius, deep gluteus, gluteobiceps. If you lift the middle gluteus, you have around the ischiatic spine, what you have is the deep gluteus. And so this is the course of the ischiatic nerve here. See, if you lift the ischiatic nerve, you will get three muscles here. Three muscles here. So one is here, it is. Yes. So one is the quadratus femoris, tender of obturator externus, or it is tender of obturator externus here, and then you have what is known as gemellus. So gemellus, quadratus femoris, and the tendon of obturator externus here. These three muscles, over these three muscles, and even the deep gluteus, the sciatic nerve will be following. And after giving the caudal gluteal, we also get one more nerve here. We get numerous muscular branches. Supplying to the different muscles here, which are the caudal group of muscles. So one is the gluteobiceps. You have the semitendinosus here, semimembranosus. All the muscles, they are supplied by this particular ischiatic nerve here. You can see one of the branches, it pierces the muscle and it comes out like this. So that is if I'm not wrong, it is caudal femoral nerve. Okay, caudal cutaneous femoral nerve, which will be present. Apart from this, you have got plenty of muscular branches here. And this is the sciatic nerve. After supplying to all this, you can see, otherwise I'll tell you about the muscles later. You can see the division of the sciatic nerve here. You can see the division of the sciatic nerve. You can see one branch which is coming out and running over the lateral head of the gastrocnemius, and another branch it is going between the two divisions of the gastrocnemius. So one which is going into the gastrocnemius, that is between the two divisions of the gastrocnemius, is the tibial nerve, and one which is going over the lateral head of gastrocnemius is common peroneal nerve. So this is the common peroneal here, and we have the tibial nerve here. These are the final branches of the sciatic nerve. These are the final branches of the sciatic nerve. So one is the tibial nerve, another one is the common peroneal. Muscular